Hello, my name is Alyssa Tilley, and I'm pleased to present to you KUSANKHA PAMODZI, Healthcare Decision-Making Preferences Among Patients with Cancer. I'm sharing this with you today on behalf of all my co-authors. In sub-Saharan Africa, cancer incidence is rising, and in many settings, shared decision-making has become the default in terms of the approach to treatment decision-making regarding cancer. Oncology teams are encouraged to include their patients' preferences and overall goals of care in determining appropriate treatment courses. This is especially important in Malawi, where many patients present with advanced stages of cancer that result in challenging and complex treatment decisions. However, there are no existing data from Malawi that explore these decision-making preferences among cancer patients to help guide their providers, and this is what led us to undertake this study. The study took place at Kamuzu Central Hospital Oncology Clinic in Lilongwe, Malawi. Lilongwe is the capital city of Malawi, and KCH is a tertiary referral hospital that serves the northern and central regions of the country. It is one of only 2 cancer treatment centers in the country and has a catchment area of approximately 9 million patients. This clinic sees about 45 patients per week and 720 new cancer diagnoses each year. It is staffed by both Ministry of Health and UNC Project Malawi employees. To undertake the study, we surveyed 100 patients that were in the KCH Oncology Clinic related to healthcare decision-making. This was a convenient sample selected from the waiting room and the infusion center. It was part of a larger study focused on cancer education, and 6 additional questions were tacked on and read aloud in Chichewa by a research assistant. The answers to these survey questions were entered into REDCap, and ultimately the survey data was summarized using simple descriptive statistics. From the results, we had cancer types included in the surveys of lymphoma, breast cancer, cervical cancer, esophageal cancer, skin cancer, multicentric Castleman disease, leukemia, and multiple myeloma. A majority of the participants surveyed were female, and the ages range from 18 to 79, with a mean age of 42. All but 1 survey were conducted in Chichewa, the national language of Malawi. Regarding our questions on medical decision-making preferences, a majority of patients have said that they actually prefer to engage in shared decision-making regarding their cancer treatment, with 68% answering that they would like themselves and their doctor to be involved in the treatment decision-making. About 29% said that they preferred the medical team alone to make decisions without their input. However, in spite of this preference for shared decision-making, a gap is noted, with about a half of cancer patients not feeling that their medical team involved them in decision-making regarding their care. 53% felt that they were never or only sometimes listened to by the medical team, again furthering this gap between their preferences to be involved in the treatment decision-making. Regarding prognostic awareness, nearly all patients, or 91%, said that they preferred to have their medical team inform them of how likely their treatments would be to lead to cure. And about 62% felt that the medical team did explain this to them in a way that was easy to understand. In conclusion, shared decision-making is actually the preferred mode of treatment decision-making by the majority of surveyed cancer patients in Malawi. About half of the patients felt that the medical team did not involve them in their treatment planning, and about a quarter felt that their medical team never listened carefully to them. Nearly all patients wanted to know the risk of mortality, but a quarter did not feel this was explained to them. And this work in general highlights the importance of engaging in shared decision-making and asking the patients their preference when it comes to discussing the treatment decision-making regarding their cancer care. Thank you.